messages were making them aware that a lot of BME people from a healthcare background, whether that is medical or non-medical staff, whether they work in a health and social care setting, is just showing how much they have been affected by the COVID pandemic. And a lot of good people, who have dedicated their lives to improving people's health, have obviously lost their life through COVID. And I was trying to get across that we need to understand that it's the BME community that's taken the biggest hit through the last 12, 14 months of this pandemic. They were on the BMA, British Medical Association website, and they were just talking about COVID-19, the risk to BME doctors. So they obviously look at evidence for increased risk for Black, Asian, and ethnic minority doctors, and what workplace support and stuff. So the figures, which is what you're really interested in, is the BMA have seen. Make sure I get this right. Yes, the BMA have seen disproportionate numbers of BAME doctors and other healthcare workers die from COVID-19. So 21% of all staff are BAME. 63% of healthcare workers who died of COVID-19 were from the BME background. 20% of nursing staff are BME, and 64% of those nurses died were from a BME background. And there's 44% of the medical staff are from the BME. 95% of doctors who died were BME. And those figures came from March and April 2020.
The NHS tonight recognised that in the past they haven't been very good with catering for different for different communities. There was a lot of focus on the experiences that some communities had, whether that be they felt almost alienated because of their religious practices, which they didn't feel were going to be honoured. Religious festivals weren't necessarily adhered to, or they didn't feel they'd be respected. There was quite a lot of wide-ranging concern, which they've identified and they're now trying to address, wasn't there?
Absolutely, there was. And it's great to see that they're starting to understand what the issues are in these backgrounds, whether you're from an Islamic background or whether you're from another part of the BME community. So they want to understand, and they've really drilled down into this. The NHS, Devon CCG, they've really drilled down to this in terms of finding out what the factors are, finding out why people feel alienated and how that could be improved so people can access healthcare services.
And throughout their research, it was quite interesting that people from different backgrounds did feel there was a glass ceiling, didn't they? They didn't visualize themselves reaching the top. Were you impressed with the work that the bosses talked about to try and help people's career progression?
Andrew, absolutely. I was impressed in terms of that they want to do more to improve the offer so that people who do become part of the NHS, whether you're a doctor, whether you're a nurse, or whether you're another healthcare worker, that you clearly, you come from your studies in Exeter or Plymouth universities, and what tends to happen is you tend to move away because it's more money up country, and it might be a cheaper cost of living. So it was fantastic to hear that actually they want to improve that offer so that people who do study locally, whether it's in Exeter, Plymouth, or even Torbay, that actually they stay local, they live local, and they actually work local.
And the report they commissioned into fairly recent experiences of working for the NHS up until April did look at the issue of covert racism, and there seemed to be a feeling that there were incidents that there was very little action as a result of the incidents, which weren't overt, but certainly there was a feeling that there was many incidents which were covert.
Yeah, there certainly was racism out there. And at least they're not being shy saying within the organisation that there have been racist incidents, whether it's between a member of the NHS staff or a patient, or whether it's between both whether it's between NHS staff themselves. And I think that was really interesting to read that some, not all, but some felt that they weren't supported. And I suppose that's part of the learning curve for a public sector organisation, that, it's silent racism at the end of the day. It does go on, and it's how you deal with it. And that also, you could say, could be part of the offer for someone who is a healthcare worker from a BMU background. That could be the difference between them staying in either South Devon, them going to another part of the country.
There was certainly a focus tonight on work going forward to support different networks from different communities. Were you impressed with that work? Have they gone far enough, do you think?
Yeah, I'm impressed with the work that they started to do. It's very early days, as of course it is for us at Torbay Council. So I will certainly be impressed on how this work goes forward, and to hopefully, to see the inequalities gap close within the healthcare system.